Purdue Pharma's decision in the 90s to begin aggressively marketing its prescription opioid OxyContin to doctors and patients for a range of illnesses despite the risk of addiction has long been seen as a major factor in the U.S.'s opioid crisis. And on Wednesday, the U.S. government said Purdue would now be held to account.
Today's announcement involves one of the most important participants in the supply chain of prescription opioids at the manufacturer level.
Between 1999 and 2018, some 450,000 people died in the U.S. from an opioid overdose involving prescription drugs like OxyContin or illicit opioids. Research has shown the rise in prescription and illicit opioids is connected, as initial opioid prescriptions became gateways to fentanyl and heroin addiction. In 2018, an estimated 10.3 million people aged 12 or older misused opioids. 9.9 misusing prescription pain relievers, 808,000 using heroin. 2 out of 3 drug overdose deaths that year involved opioids. Purdue Pharma has admitted it paid doctors and pharmacists to prescribe OxyContin without a legitimate medical purpose, a practice alleged to have subsequently become widespread among other pharmaceutical firms, and that it misled regulators about how widely it was distributing the drug. The companies agreed to an $8 billion settlement. However, it's likely only to pay a fraction of that amidst bankruptcy proceedings. The Sackler family, which owns Purdue and was able to sponsor cultural institutions around the world with the billions it made from OxyContin sales, has agreed to pay $225 million and give up ownership of the company.
In some small states in the United States, $8 billion doesn't even cover what one state would be the cost. Just in terms of, cost to hospitals and jails and coroner's offices and foster children agencies, and you can go on down a very long list.
Purdue still faces hundreds of other lawsuits. Some state attorney generals say the government has let the company and the Sackler family off too easily. The fines are comparatively minimal, a cost of doing business, they argue, and no one is being criminally or civilly prosecuted for the enormous devastation caused by their actions. Nonetheless, a few weeks before the election, the Trump campaign will now be able to claim it lived up to a Trump campaign promise from 2016 to go after Big Pharma and address the opioid crisis. Shihab, Rattansi, Al Jazeera.